here. Thank you so much for coming. So we have a very exciting announcement to make, and we asked Congressman Kennedy, who has been so helpful in helping put forth substance abuse and mental health services, especially for this region and this end of his region, his district, where the need is so terrific. So I want him to make the announcement of what we are receiving, and then Victor Gravio from the Association for Behavioral Health Care will talk a little bit. And Pat, I didn't know if you, at the end, if you wanted to say a few words about what we're hoping to do in sort of minutia. So, Congressman, thank you so much.
Stand up here with me.
I know we're frightening.
Folks, I'm honored to be here today. I am excited to be here today. And I cannot wait to break the news, which I think some of you know. But and it's an extraordinary testament to what STAR does, to the work that you all do, to the need in this community, and an affirmation of what a vision for mental behavioral health care can be when we truly make a commitment to make sure that everybody who needs care can get it. SAMHSA, our federal agency is responsible for delivery of mental behavioral health, has awarded you all $1.8 billion over the course of the next 2 years to try to make good on that promise. So congratulations. And to put that in context, this is not only is it critical funding, this is an affirmation of the work that you all do day in and day out, and the vision that you all put into action every single day, about making sure that today, given the need that we experience across this country and in every single community, that people that are struggling with mental behavioral issues, that are struggling with addiction, get access to the care that they need. And my hope from this award is that we will take the results of this program over the course of the next 2 years and be able to take that back to my colleagues in Washington and say, look, this is what happens, this is what you can do, this is the type of community we can be when we actually invest in the system. Because as tremendous as this award is, there is not, grant funding is not a substitute for the dedicated direct lines of resources that are necessary in order to flesh out a holistic of care to every single person that needs it. But what you all have here, what we are investing in, is every single one of you to show our country, to show our Commonwealth, what can be done when we make that commitment to every single person. So, good luck, congratulations, and thank you. Thank
you. Thank you, so you can stay. Thank you for inviting me here today. My name is Victor Gravio. I'm the president and CEO of the Association for Behavioral Health Care. We're the statewide association in Massachusetts that represents organizations like STAR. Nancy is one of the key leaders on our board of directors. I'm also here because I'm a member of the board of directors for the National Council for Behavioral Health, which is our national association. And the Certified Community Behavioral Health Clinic initiative really was born out of the National Council's efforts to strengthen the role of community-based behavioral health clinics, not just here in Southeast Massachusetts, not just in Massachusetts, but nationally. And as the Congressman talked about, this is a nationwide effort, and the goal is to provide access upon demand for people who need it when they need it. We don't do that right now. STAR, as always, is a little bit ahead of the curve in terms of open access and being innovative. This grant will allow STAR to expand that work, but it's something we need to implement nationally, because we need to make sure people have access to care, not just for opioid issues, but for mental health issues, other addiction issues. So I'm honored to be here. Nancy is one of the true leaders in Massachusetts, as you know, and nationally and internationally. This is a great day for STAR and a great day for Massachusetts, so thank you.
Thank you.
Thank you.
I think you use your help, but I know you're not feeling well, so if you want to sit down.
That's all right.
All right. So first I want to thank Congressman Kennedy for your leadership and hard work on behalf of the issues that mean so much to our patients in this region. We're very lucky to have you representing us. And Vic, your leadership and effective advocacy with the national and state leaders has made such a difference in this particular thing as well as so many others. So I want to tell you about what we're going to do with this, some of the things that we'll be able to do with this funding. This is really going to help us more effectively address the opioid addiction by providing better care for our patients, more timely care, and have the long-term sustainability of STAR, which Vic sort of referred to in terms of this being the beginning of us being able to get funding that will really sustain the kind of work that we do in the outpatient, offsetting the outpatient deficit that we've had for decades. So with the funding, more of our patients will get the psychiatric care that they need. We're down 3 psychiatric providers and have had a very hard time recruiting. So this funding permits some incentives, recruiting incentives, so that we'll have a better time of being able to recruit the psychiatric providers we need. We're going to start a new co-occurring day treatment program so that patients that leave inpatient psych and our inpatient dual diagnosis, they could step down to an intensive 5-day-a-week program right here that would combine psychiatric services, primary care to monitor the medical side effects that sometimes go along with psych meds, as well as medication-assisted treatment like Suboxone and Vivitrol right in that one program. So that brings Nancy's vision of integrated care to a whole new level. We're going to expand mental health services to children and their family. And these grant activities will strengthen our collaboration with local groups such as the emergency rooms, the emergency services workers, and veterans programs. The workforce development aspect of the funding will include intensive training in DBT. So that's a model of treatment that's proven to be especially effective with our population. And we'll be providing on-site training for 15 of our clinicians and offer it to some of the clinicians in other agencies in the community. And that training is going to include more long-term video supervision with a national expert in DBT. And we'll be creating a curriculum and new workforce of family peer recovery specialists. And we'll introduce some new motivational strategies, including a wellness mobile phone app that will help our patients change their behaviors like smoking, lack of physical activity, diet, stress, that really underline the major health problems that all of our patients have. So we expect that that will have an impact on the health outcomes of our patients and the health of our community. Implementing these initiatives will result in our achieving designation as a certified community behavioral health clinic, which Vic was talking about. And it's a new federal category that, with the advocacy of leaders like Congressman Kennedy, will lead to significantly higher reimbursement rates in the future and help STAR sustainably offer the services that our community so desperately needs. So we're very grateful for this opportunity and the work that this represents of our leadership. So we're looking forward to working on this.
Thank you. So that concludes the program today. I know that many of you wanted to meet Congressman Kennedy. He has maybe about 15 minutes to give us, I think. So please come and meet and thank him for his advocacy on our behalf and for people with mental health and substance use disorders. We thank you so much.